Greetings to all my dear teachers and friends. Our motion is attenuating growth for profound disability should not be allowed. Let me define some terms for clarification purposes of our debate. Firstly, attenuating growth simply means an elective medical treatment which involves the administering of estrogens that can cause the closure of epiphyses of bones. This results to a person's reduction in adult height. In summary, it is actually a treatment used by surgeons to stop the growth of a person. Another term that I want to clarify here is estrogen. It is a steroid compound that is found in both male and female body. It is mostly found abundantly in female body as its primary function is to promote the development of the female secondary sexual characteristics. However, if estrogens are found abundant in male, he may suffer from gynecomastia, which is the development of abnormal large mammary glands resulting in breast enlargement. Another term that I would like to clarify has to do with the female organs. This is called hysterectomy. Its name came from the Greek word hystera, which means womb. It is a surgical procedure that there is a total or partial removal of the uterus. This is usually performed by gynecologists. In addition to this, another term that I want to bring your attention is to static encephalopathy. This was used on situation of Ashley. This means a permanent or unchanging brain damage caused by a disease. This usually makes a person unable to control her own movements like sitting, holding head up, etc. Last but not least, the term bioethical is a philosophical study of the ethical controversies brought about by advances in biology and medicine. It is concerned with the relationships among life sciences, biotechnology, medicine, political laws, and philosophy. With these terms in mind, the proposition would like to say that attenuating growth for profound disability should not be allowed. The proposition has a very strong stand against this medical procedure. There are a lot of issues concerning this newfound technological advancement in the field of medicine. The process of which that the doctors will use estrogen for this medical procedure. By stopping growth, doctors believe that it would be easier for parents to take care of their child with special needs. Is this the whole truth or not? There are a lot of side effects for estrogens that would be discussed later on. There are a lot of questions concerning the health of the patient and also queries about the future of the child that will undergo this procedure. We will always keep in mind, is this for the best interest of the child? And are the parents just thinking of their own personal interests and not really the child's overall good health? One issue on this that is widely asked by people is the concern that the doctors are not thinking about the patient's overall wellness, that the Hippocratic oath that the doctors are swearing to practice medical ethically is not really taken seriously. The doctor's oath of do no harm to the patient is the one in question. With not going through the procedure of stopping the growth of patients like Ashley, the doctors is not doing any harm to her. The child will not be suffering the side effect of estrogens since the child would not be taking them. There is no necessity to go through surgeries or more medical procedures just to correct a mistake that is previously procedure made. There would be more time for the child to be with his or her family rather than spend most of the time being treated in a hospital. If we think about the bigger picture, are the doctors really doing the good when all they would be giving the child is more pain, more problems, and more medical treatments in the long run? Is it really necessary for doctors to think of the option of stopping growth just because a person has a 3-month-old brain? Are they really thinking of the patient's welfare, or are they just in for fame? We think about these things and we would see that the doctors did not really give parents the real picture of everything they would do to the child, that they did not present the other options that the side effect might have the child on in the future. With this in mind, I would like to reiterate strongly again that attenuating growth for profound disability should not be allowed.